first question. What is your go-to argument or go-to introduction to longevity? Because people have very varied responses when they first hear about it. And you are probably the one person that knows most about the subject that I know personally. So I'm curious, what's your go-to communication?
Everyone agrees that we should cure cancer and heart disease and all these diseases. But then when you talk about curing all of them and sort of addressing the root cause of them, like which is aging, then people sort of have some kind of blockage there, right? I think people are afraid to hope um, because you already sort of coped with the fear of dying at some point. You put it out of your mind. It's scary, right? And now if you have some false hope, which has been given by a lot of snake oil salesmen over um, since the the dawn of civilization, probably. Um, I think people have a huge aversion to hoping for that and then being disappointed later on and aging, degenerating, and dying. But nobody actually wants the disease. Nobody wants the suffering, right? Everyone wants to be in optimal health and they want freedom, freedom from disease, especially. So just the argument is it's a better approach to medicine. We're trying to cure these diseases anyway. We just should do a better job at it from a better angle.
From an angle of being more just courageous, perhaps, to actually aim for.
Yes, and we do need to be more radical like that, more courageous, right? Because if you want to fly, if you want to go to the moon, if you aim high, you can't just like climb on higher and higher trees, right? That's just not a good strategy. You just need to rethink things, right? So the same with this, like if we're just managing symptoms of these diseases, it's not gonna get us anywhere. It's a losing game. It's whack-a-mole medicine, you know. You make the person be in a poor state of health, but for longer. And people spend 80% of their lifetime healthcare spent in their last year in a hospital bed, basically. Um, and it's just not a good strategy, right? Um, much better if you turn the problem on its head and say, what's the root cause here? Instead of managing symptoms, let's address it. Let's address the cause, right? It's just aging itself, which is at the root of all of these age-related diseases that go up exponentially with age in humans and every other organism that ages like humans, but not in all organisms, right? There are animals that don't seem to age. Their rate of dying doesn't increase with age. It's just more like predators, other diseases, and so on, which you could consider also, you know, microbe predators, right?
It's definitely
But
possible in some sense to live long. I'm curious, when did your interest for this subject arise, and what are you doing now to work, because you are heavily invested in the subject? What
oh,
started the journey?
um, I think one unique thing is that unlike most young people, I've had a lot of health issues growing up. From a very young age, I spent a lot of time in hospitals. You know, I've had many surgeries, and so I'm kind of present to the idea of what it's like to be frail and um, to just kind of like an old person. And I wanted initially to be a doctor to work on these kinds of things, but then I realized, first of all, I'm on the spectrum. I'm not able to really talk to people. I wasn't back then. I was very shy. Like I couldn't be a clinician, right? So, but I was good with math and computer science, and so I went into that stuff, things that I could do introvertedly. But eventually, I realized also, like being a doctor doesn't mean I'm going to cure anything, right? What you really need is biomedical innovation, pharmaceuticals, biotech, right? To innovate at the intersection of technology, engineering, and biology. Fascinating stuff to me. But I think, yeah, most young people don't think about the degeneration that will come later. They feel invincible, right? So they don't think about this stuff.
Yeah.
And in a way, I'm lucky that I was present to these ideas, to these issues. And so I thought, hey, this is the most important thing. First of all, I want to ensure that I have health and I'm not going to degenerate and I just can enjoy life because I fucking love life. Existence is just awesome.
Yeah, you radiate a really joyful aura when I've been around you. I think you have good outlook. Would you tell me more about this Vitalia project that you are working on, that you co-founded recently? What it's about, and how is it going currently?
It's about making a gargantuan effort of coordination in person. So gathering people in a city like Los Alamos, but for this goal of curing aging and making death optional. Um, cities have been built before, like Los Alamos, to fix a scientific crisis. There's a lot of benefits from having a lot of innovators in the same space, but also most importantly, um, we can create our own laws and regulations if we're living in a place as a community. We have the legitimacy to govern ourselves, to play by the rules we set out instead of other people set out for us, right? So then we can say, hey, let's make a regulatory environment which allows warp speed innovation, warp speed clinical trials. Like, the whole world was thinking COVID is a crisis, therefore we should speed up things, and we made a vaccine in 8 months instead of the usual 10 to 15, look, 15 years for a vaccine. Um, and we could have done it in 4 months if we allowed challenge trials. But how about we do the same kind of we have the same philosophy of this is a crisis for Alzheimer's and heart disease and all these diseases of aging. I think just the world, even though it's much bigger, a much bigger issue, 110,000 people die every day, 40 million people die every year from aging, and hundreds of millions of people are suffering right now, right, from this degeneration. Um, but people don't see it as a crisis, right? It's always been there. It's like water to the fish. But some people, like us, think that this is a huge issue and we should treat it with more urgency than COVID. And not everyone needs to agree. We just go in a sandbox and try out this thing and show the world what works, innovate, right?
I like the story of the dragon. If people want to look into that another time, but you how did you create this sort of a mini city with where the sandbox, as you call it? It's in Honduras, but do you have some agreement with the government? How did you get that sandbox to begin with?
So yeah, initially, as one of our projects in VitaDAO was ready to go into humans, I realized that such a huge bottleneck with the FDA. Before, I was just kind of thinking, let's create more IP. Let's take stuff from academia. There's just people just writing papers and nothing happens, to a product, to IP that can be investable, spun out into a startup, invested by angels and VCs, right? And then taken forward through the biotech pipeline to eventually clinical trials by pharma. And I was thinking, that's pharma's game. They do the clinical trials. Um, but when we're thinking about decentralized science, not just funding it early stage, but we're like, why not also do decentralized clinical trials and do them much faster, especially with this framework of we need to do it at warp speed when everyone in the world doesn't seem to agree um, that this is a crisis. Then we're like, okay, let's take it within our own hands. So where do we do this? How do we go somewhere physically? We can't give people online medicine as VitaDAO. It would be nice to have a location where we can do these trials in a better regulatory environment. So where do we do this? And we came across Prospera and we thought, okay, this is good. There's this whole idea of network state. You have a DAO, this online community that is all over the globe, and you could crowdfund territory all around and have this like archipelago of islands. But the thing is, obviously, it will take a long time until in that territory that you technically own, you can create your own laws and regulations. But Prospera is the only place which already exists that has a special jurisdiction where you can create these better frameworks. So there's medical freedom. It's more libertarian, right? People can um, do what they want with their body, and companies can act on a common law framework. So as long as you have a contract and you have informed consent and all this, it's all good, but you do need regulatory insurance. So instead of having one monopolistic paternalistic regulator like the FDA that says what you can and cannot do and has this incentive to slow everything down, to make it very expensive over 10, 15 years with billions of dollars, insurance companies, if you have multiple insurance companies, they can compete, right? So they have an incentive to also move fast and be safe, because obviously if something goes wrong, the insurance company has to pay out the liability. So you kind of have this environment where it's not free for all, where people are doing crazy shit, but you also are being reasonable, right? It's not like setting the speed limit at 5 miles an hour because people are gonna die otherwise. You got to be reasonable. You also want to move fast and get to your destination, right? But you also don't want to kill people, so you make sure that you have some kind of balance. Prospera is a special jurisdiction on Roatan in Honduras, and that's our first district. And we're also talking to other governments to establish more districts. We don't want to have a single point of failure, a centralized location. We want to be a decentralized city, both in governance, so that's governed by the people, and in location, such that it's um, at least 2 to 3 locations that people can move in between if one of them doesn't uh, work out as well anymore.
I love that. I love that. It makes a lot of sense to set up some place where you can show that something is working and then bring it back when it's just so obvious that this is good for people and have this sandbox. I'm curious, what are the projects you have brought started on, or just in general, projects you are excited about now that you have the possibility to try them?
So one therapy that already exists is mini-circle follistatin therapy. It's a gene therapy that's reversible, and people have been so they kind of started with a quick uh, phase 1 trial for safety. They had a few dozen volunteers, and they did it in a few months with a few 100K, super fast, right? Much faster than they could have done it in the US. And then once safety is proven, you can start selling it. So they've been having customers, paying customers for a while. Brian Johnson was one of them. Recently came here. Then he brought a bunch of his friends during Vitalia, and that's the most advanced example I can give you of something. Follistatin is shown to extend lifespan in mice by 30%, and it inhibits muscle loss. So people put on muscle more easily, and also the most importantly, you don't lose muscle as you age as much, which is a huge problem for our lifespan. But there are many startups in Vitalia. We had the 30 companies present at our demo day a few weeks ago. And some of them are going to have gene therapies that are very exciting for aging in just a few months.
Is VitaDAO, so any of these projects are connected to VitaDAO or this follistin therapy?
Some of them are funded or connected with VitaDAO in some ways. Vitalia itself is spun out as a separate entity, but it's very synergistic with VitaDAO, and you know, the industry isn't that big. We all know each other. We collaborate with many other
Right.
organizations.
You mentioned that Brian Johnson. Just briefly, what is your intuition about him? You met him, I assume, in person.
Yeah, yeah. I'm glad he's taken this approach of biohacking and taking his personal longevity, but also looking at what are the more advanced therapies. And initially, I was kind of criticizing him for not focusing enough on the biotech, medical innovation. It's like, come on, this diet and exercise stuff is not going to get you anywhere. But so now I'm glad like his whole blueprint team is acting in a way kind of that like a certificatory approach, like a consumer reports. So you don't need the FDA to tell you if this is good or not. You can have something like consumer reports, something like blueprint, right? And a lot of people are convinced by that. They don't care that the FDA approved or not approved something. But if Brian's team of doctors have checked this out, then they do take that as a good indication, stamp of approval, and they should also still do their own due diligence, of course, just like for everything. But I, so I'm glad he's doing it. Um, it's also interesting that he's building a network state, a don't die network state, right?
Yep.
And talking also about having some in-person locations and this online community as well. So it's very, very synergistic, I would say.
Yep, it seems to be booming a bit more, the longevity space. But you are now calling in from, as I understand it, Vitalia. You are there. How many people are currently? You said that you mentioned some startups. What are the numbers? How many people have been there? How many are living there? And what's the current situation?
So we brought about 400 people the first 2 months. Over the first 2 months, it was like the peak was like 200 living at the same time. This felt like a booming city and so on. And then we went into an acceleration month in March for the core group of entrepreneurs, about 50, and 30 startups presented. Now we're actually, I'm not even sure how many people are coming. Tomorrow until Sunday, there's this conference, Crypto Safe Haven, or sorry, it's called the Safe Harbor Conference, providing a safe haven for crypto projects in general. And this idea of, so crypto is more about coordinating people, right? It's not just making a new form of money. Money is about coordinating people. So crypto is exploring how to coordinate people in better ways. And of course, the goal is to coordinate a lot of people in a major way against aging and death. So we do need all kinds of new projects that rethink incentives and so on. And a way to raise capital through tokenization for companies and for land, real estate here to build the city. So we're creating regulatory frameworks and legal engineering discussions on how to really provide that safe harbor to innovate.
So do I understand you're around 50 uh,
So
entrepreneurs
so
currently?
50 people were in March.
Mm.
Now in April, I'm not sure. It's fewer people that are more focusing on this regulatory
Mhm.
hacking acceleration. Next month, we're gonna also have quite few people, a few dozen that would build. So there's this apartment tower. I'm not even sure if I can see it from here. This the largest, the tallest tower on the island, and it's being ready in a few weeks.
Mm.
Um, I know we've been saying that for a while, but it really is looking complete. So just in a few weeks, it will open, probably 2 or 3 weeks, it'll open. And so next month in May, it's kind of our superabundance construction month. We prepare the space. And then after that, we're gonna have a big focus on biohacking and bring more people. The goal is to have about 200 people this year. And I think the way to get there is more towards the end of the year as we have more housing available to have a few thousand people come by. And yeah.
How disconnected are you from the rest of the world? If you are 200 people there, are there like other people not connected to Vitalia, or is it just that? How is the environment?
So initially we were just in this resort as the main activity, but then also our people, we didn't have enough housing in this in Pristine Bay Resort, so we booked a bunch of other resorts nearby, um, just really next to the entrance, and some apartment towers as well that are smaller. So in Pristine, it was basically just us, maybe some existing residents, homeowners, and then outside there were a lot of other people as well. And there's a grocery store nearby. It's like, yeah, kind of pretty well integrated within Roatan, but inside the resort itself, it did feel kind of like an enclave. But now we're expanding into this other side, which is like the original jurisdiction of Prospera, where there's this apartment tower and there's this other village here. So a bit more integrated with the village is the idea. And then we still will need to actually expand even a lot more for thousands of people. So we're going to be pretty integrated with the island, I think, and want to help actually with the diabetes problem here. We want to help with healthcare on the island, even short term.
That's beautiful. I really love the project, and I wish you the best of luck. You mentioned crypto as a tool to coordinate between people, and you have been part of one of a very interesting project, VitaDAO. And I'm curious of your thoughts now that you have been doing it for several years. How's it gone? What are the results and just general thoughts on VitaDAO?
It's been amazing to see this novel way of funding research and making it sustainable. So it's not just, oh, we give some money to this lab and then they come up with some therapies that then can spin out and raise through the traditional model. We actually create a token for each of the projects. So there's the Vita token, which you can buy to govern the whole organization, right? What kind of projects we fund and so on. But then there's a project, for example, at Newcastle University for autophagy inducers, small molecules that mimic fasting, right? So we called it VitaFast. It's a subtoken, right? And so then you can govern that specific project. And the cool part is it has its own token, so it can then issue more tokens and raise more money to make that project, to reinvest in that project and make it successful. And so we have some companies and then some sub DAOs in a way. And these sub DAOs that we spin out are the most interesting to me because it provides a self-sustainable model for DeSci to take a project all the way to success in a decentralized, permissionless manner with a community rallying around the kind of projects that they're interested in. And so some of the projects have advanced. But it's hard to say like because we haven't done clinical trials in any of them, so we can't say like, oh, success. But we have had some preliminary results, right? Some hits on some screens with molecules that seem in cell assays and some companies, of course, have some of the projects have shown good results in animals as well. So we're kind of, I think, making a lot of progress on this valley of death, taking stuff from academia into more investable stuff. The coolest part is how we have been able to scale and be efficient as a DAO. A new way of coordinating people towards the common goal, right? And uh, these new primitives that we've been able to build, and I think it's just setting the stage for a lot of projects being able to be funded in a sustainable way and just raise billions.
And moving much faster than traditional systems. I hear good things about VitaDAO whenever I talk about it. Would it be fair to say that when you issue these new tokens, it's like stocks, like you're issuing stocks for a small company, or what is that not a fair
No,
statement?
no, because so these are governance tokens. They um so first of all, Vita is a governance tokens for the whole VitaDAO organization. Um, it doesn't
Also,
promise,
it
it's not a
works.
security, right? So that's very important to clarify. And each of the projects as well, they're different in a way that are more like IP pools. So there is an asset there for each of the, like VitaFast, for example, it's governing an asset. Um, and I'm not sure exactly how things are structured and worded because it's kept changing. We wanted to allow people to govern future proceeds, but not promise it. And things have changed, so I'm not exactly up to date on what's the current status of it.
I actually not meant like in legal terms, what
But
it is,
really, like,
but more of
yeah, I know, but legalities do get involved, especially when talking publicly about projects and tokens and so on, right? So, um, it's it's really important to understand that the goal is to make that project successful, ensure that that science advances to a point where it can actually become medicine, and if it has sales and revenue, that is to be figured out whether it's reinvested or depends on the regulatory environment if there's any ability or desire to give those proceeds to token holders, but that could potentially get it into the securities regulations nightmare, which is why I was talking earlier about the Safe Harbor conference that we're doing this weekend. So we're creating a regulatory framework in Prospera, not just for biotech, but also for tokenization, so that people can tokenize, actually make security tokens without any issue. So of course they would still have to exclude Americans and any country that has the securities regulators not wanting to access their market. But the point is that there should be a way to tokenize and anyone to permissionlessly buy those, as long as they're not breaking the contract that says you're not a US person or things like that. And then, ideally there's some liquidity on a secondary market. But we haven't yet done the whole regulatory framework, so that's why I'm not able to fully say exactly how everything is going to look like for VitaDAO's projects and all the DeFi DAOs that exist, that have kind of started in a certain environment, and for the environment we are trying to create and potentially enable people to do things in a much more straightforward way with actual securities, right? That so people are ensured that if there's proceeds, they will see some of those proceeds. With securities, you can do that, right? But we cannot really promise anything yet because we don't know how it's all gonna settle down. I need the final approval from lawyers, right? So
it's a living thing, and but let's leave it at that. I'm curious about your current interests, or what excites you currently in the longevity space. Like, where do you see the most potential, or perhaps you think, how do you think about that? What excites you currently in the space?
reprogramming, I think, is one of the most exciting parts. So partial reprogramming, which are come from the Yamanaka factors, Nobel Prize winning research, where you can give these transcription factors for genes, for proteins that you express in a cell, any cell, and it becomes younger. It becomes a stem cell, as young as like age 0 embryonic stem cell, right? But partial reprogramming means you give this therapy and you make your cells a little bit younger, not all the way to stem cells. You don't want to become a blob of stem cells, right? You just rejuvenate. The thing is that our body has this ability already, right? We can make new babies out of old people, right? So there's a rejuvenation component already built in to make babies. And then another one is damage repair approach. Just treat it as any machine, any car. You need to clean the filters, replace parts, things like that. So also the replacement approach, I think is quite exciting because we know it works and we can do it. We just need to improve the way we replace organs, maybe even whole body replacement, like growing another body and transplanting your head onto it. That's really like, we know that that's gonna be at least short term, medium term useful until we figure out a way to do it at the molecular level with gene therapies, cell therapies that we just take in and then they go and fix all the problems. Yeah, replacement is really interesting. So reprogramming, damage repair, replacement. Also, another one is the hormonal replacement part. So not replacing organs, but rather ensuring that you have the hormone levels of a young person. One of the companies in Vitalia, we just gave a grant to build a lab, a little lab equipment, and they became a company. They raised a few hundred K already, and they're doing implants. They're already putting implants into people. And one of the implants you can put in is like the insulin glucose thing. So you measure continuous glucose and you give insulin to diabetics, with insulin pump and continuous glucose monitor is basically an artificial pancreas. Well, you can do that for many other hormones. You can test the level and give more, right? So you can have these implants that give you any sort of chemical, hormone, drug, whatever, as you need to keep your levels in your blood as you want them. So that's a really, really interesting approach that I haven't really seen explored, but I think it's going to be explored here. And then another one is kind of a wild card is bioelectricity. It's not necessarily for aging specifically, but with bioelectricity, Michael Levin has been able to. So like in reprogramming, there's Altos Labs, David Sinclair, Retrobio, um, and Turn Bio that we invested in actually. Also New Limit, Brian Armstrong. There's these companies that are leading the charge there. In damage repair, I would say there's Aubrey de Grey with Sense and now Longevity Escape Velocity Foundation and companies like Repair Bio and Cyclarity and so on that just go and like clear up the cholesterol or make your arteries more elastic or things like that. Just repairing. Then on the replacement front, Jean Hebert with BE Therapeutics is like the top researcher and company in the field of replacement. There are a few others that are in stealth that I can't mention yet. In the hormonal replacement is basically I've seen a lab at Berkeley, but also in Vitalia, and then on bioelectricity, Michael Levin. So bioelectricity is showing great promise for like even regeneration. Like you can show you can cut a limb of a frog and change give it a drug that interferes in the ion channels to change the bioelectricity there, and it regenerates the limb. And there are many things that you can do with it that could rejuvenate. It's like anti-cancer stuff or even detecting cancer. But yeah, I'm bullish that that could really be applied to aging and longevity, but it's not like a specific longevity approach, even though that's, I think, the biggest potential for it.
You paint a picture that's very exciting, but lots of things are happening. Have you read the culture books by Ian M. Banks, these science fiction books?
No, I started, but I didn't. It's been a long time since I picked up
Some of
the
those
series.
projects sounded like straight from a sci-fi book that he wrote. But before, what are some biggest thresholds or biggest what do you call it, bottlenecks currently? Well, what's like the biggest problem as you see it that should needs a solution still?
We need um in this district we need more people and more housing, and outside, we need governments to agree to give us that special jurisdiction, that medical innovation zone where we have more autonomy, because not everyone is comfortable to come to Roatan, and also it's just not a good idea to have this uh, single point of failure. Uh, then to be able to fund more companies to do these trials fast, like 4 months instead of the usual 10, 15 years, right? With like on the order of $1 million for a drug instead of billions. Um, I would say also funding for Vitalia itself to move faster, build faster the platform, right? But then also funding for each of the companies. Um, yeah,
Nice. A
more
final question.
people in general, I think, excited about us and um, joining, contributing to spread the word, contributing to work that needs to get done.
More
Um,
people, more money, more attention, energy. Have
yeah, I mean, the like society should just direct attention way more than COVID crisis, right? On this. And where is everyone? We're creating these tools, right, for coordination. And I hope once they're here, and if the world also wakes up, which is another project I'm involved with. I initiated Jellyfish DAO to make movies to inspire the world to kind of wake up and be like, and so yeah, just if we get a very popular Hollywood movie showing
Mhm.
longevity in a positive light and kind of inspiring people to do something, I also want there to be the tools like VitaDAO and Vitalia for people to be like, okay, I know there's this place I can go and contribute either online or physically in person, I moved there. So I want a million people to move here. Yeah,
More propaganda, more
just text me and I can help you move.
lovely. A final question: what's a book or some content that has influenced you a lot during your life, or maybe recently? Any suggestion? Maybe it's a blog, movie, could be anything.
The Beginning of Infinity by David Deutsch, really around how to think and not be afraid to be wrong, like actually seek being less wrong, the whole rationality space, right? Just be comfortable with uncertainty and um, yeah, be very skeptical, and that can really, really help in everything, any goal you have, right? To be more scientific about it. And I mean really scientific, like actually explanations that are hard to vary, that you work in paradigms and you actually try to falsify any conjecture, any hypothesis. And this just in everything you do. It's not just about science and like biology, biotech, and so on. It's really because the kinds of work I'm doing is not in the science, right? I'm just working at the level of coordinating people. And even there, it's very important to try to overcome our biases.
All right. And where can people find you if they want to learn more?
On Twitter, Longevion, or just Laurence Ion, and on Telegram, Laurence Ion.
Thanks, man. Hey, God bless, and thanks for all the work you're doing. Good stuff. Thanks for the time.
Thank you.